Hi everyone, I'm Weihui Zheng from Zhejiang Cancer Hospital. Today I will present my title is Preclinical Study on New Parathyroid Recognition Technology in Thyroid Surgery. Okay, this is the context. I will begin the abstract, and the two core technologies is the negative image and the positive image. For the abstract, I want to make it more understandable for why and how our study. The parathyroid gland is the smallest organ in the body, but it plays a very important role in the regulating blood calcium. Accidental removal of the parathyroid during the thyroid surgery is a major problem, so we need reliable ways to identify it. So we test two methods. First, negative image with iron oxide nanoparticles, IONPs. These dark nanoparticles stain the thyroid and lymph nodes black, but not infiltrate the dead parathyroid, make it stand out. Secondary, positive image using antibody combined with the fluorescence. We link the fluorescence to the calcium sensitive receptor, CASR, a protein only found on parathyroid cells, so the parathyroid lights up by the anti-G antibody binding. Our result is IONPs achieve clear negative image in rats and rabbits with almost no surrounding tissues contamination. The CASR's linked fluorescence successfully lit up the parathyroid in rat models. In short, both techniques work for intraoperative parathyroid gland identification and deserve further clinical researches. So now let's focus on the negative imaging. First, we need a benchmark. So we studied the clinical standards we use the carbon nanoparticles, CNPs. Figure 1 shows our clinical study with 8 patients. Before CNP injection, surgeries couldn't tell the parathyroid gland from the thyroid by eyes not very easily. So after injection CNPs into the thyroid turned back and the parathyroid stays unstained. This contrast helping surgeries preserve the parathyroid. And then we qualified this. CNPs increased PG and TG's Greer scales contrast by about 81% from 0.21 to 0.68. While this wasn't not statistically significantly, it was enough for surgery to distinguish the two. So we use this our clinical standard to test our IONPs. This is the first from the clinical data. And then next we characterized our IONPs to compare with the CNPs. We tested 3 different sizes. One is 10 nanometers, IONPs 10, and 15 nanometers, IONP 50, and 100 nanometers, IONP 100. Figure 2A shows all IONPs are dark brown and black, just like the CNPs, perfect for naked eye imaging. Under the TEM, IONPs are well dispersed, while CNPs form larger and dynamic light scattering confirmed IONPs had the smallest diameter and narrow size distribution compared with CNPs. These proportions made IONP 10 a strong candidate for further testing. So we found the best IMP for imaging in order to find this. So we optimized the size and concentration in rat models. Figure 3a shows intraoperative imaging. PBS did nothing. CNP stained the thyroid but leaked into nearby tissues. IONPs give the cleanest contrast. You can see the parathyroid next to the dark stained thyroid and the tricky. Quantifying this from figure 3b, IONP10's PG and TG construct jumped from 0.199 to 0.839, better than IONP 15 and IONP 100, and even match the CNPs. We then optimize the concentration, figure 3 to D. IONP10 at 20 mg per ml had the highest contrast. So we choose the IONP10 at 20 mg per ml as our optimal negative imaging agent. And then next, we did a head-to-head compare of IONP10 and CNPs in the same animals, rats and rabbits, to confirm efficacy. In the figure 4a shows that rat tissues histology, the thyroid has risen ruminal, so while the parathyroid is dense, so no inferiority. This is why both agents work, but IONP10 is better than stain contained. In rat model, we inject IONP10 and CNP into the different thyroids, and then we found IONP10's PG and TG's construct was 1.75-fold higher than CNP's, and even we switched inject sites, IONP still outperforms. And in the rapid model, with the results was similar. So IONP10 had equally or better contracts than CNPs. This cross special value proved IONP10 is as good or better than the clinical standard. Next, safety is the key. So we also tested the IONPs 10 avoid the big problem with the CNPs is the tissue contamination. In the figure 5a shows patients' samples. CNP leaked into the trachea and esophagus. There are no biodegradable, so this is a long-term risk. In the rat and rabbit model, CNPs spread to surrounding muscles and organs, but IONP10 stayed only in the thyroid, no leakage. So in the ex vivo imagery, confirmed these two. CNPs contaminate the esophagus, while IONP10 was confined to the thyroid. So this is the huge advantage. IONP10 doesn't risk permanent tissues stained or damaged, unlike CNPs. And later, finally, we also did the test IONP10's biodegradability and safety. Clinical for the later makes possible. So from the figure 6A or B shows 19 days results in rats. IONP10 was almost completely degradable in the thyroid, while CNPs were still visible and had spread. This means IONP doesn't accumulate in the body. For the acid toxicity, we mentioned some biomarkers in the blood, like liver functions, kidney functions, and calcium or C-reaction proteins. There's no significant changes before and after IONP's injection. This proved the IONP-10 is safe. It doesn't harm organs, disrupt the calcium levels, or cause other damages. So it means effective and safe. Okay, this is for the negative images. We can find, to sum up this, IONP-10 is safe and effective for the negative image for the thyroid, parathyroid gland. And next, let's turn to the positive images, our second technologies. First, maybe let's see the clinical needs. It's very easy to know like this. As we know that thyroid cancer is the top endoscopy malignancy. Even in Zhejiang, it's the #1 female cancer. Most the treatment for the thyroid cancer is do the surgery. So parathyroid image is very common. So it's the surgery treasure. We wanted to give another positive image to solve this problem. And our target is the calcium sensing receptor CASR, which is the only expressed on parathyroid gland cells. For this, we target the calcium sensitive receptor. This is very highly specific to the PG chief cells. No TG and no lymph nodes express. Our protein is CASR antibody plus the NIR2 dye and plus the cleavable linkers. Linkers will relieve free dyes which diffuse to surrounding cells to boosting the image contrast. This is called the bystander effect. Go back. Yeah, we will use the 3 animals models, the rats, New Zealand rabbit. For the New Zealand rabbit is the anatomy variations in the thyroid gland. And then the PDX mice use the human tissues validation. NIR image is used for deeper permanence, reduce autofluorescence. Confocal microscopy and flow cytometers confirm the bystander effect. And then the HIC shows CASR is highly expressed in human PGs, no off target. Our CASR iodide 800 probe has the optimal NIR2 fluorescence and the tissues permanence is ideal for the intraoperative use. For this bystander effect, we will use the free dye from the cleanable linkers, creating uniform PG signal. This is the first time ADC-derived bystander effect is used for surgery navigations, protecting normal tissues, not just targeting the tumors. And here is a video about the positive image. I'm sorry, it couldn't be translation in English, but it will not affect our understanding. First, we will just synthesis of fluorescence protein and targeting the calcium sensitive receptor, inject into the vein, and it targeted the parathyroid gland. The linkers then release the fluorescence, lighting up with the parathyroid gland. Okay, let's go back at the abstracts. So in my presentation, I was just wanted to try to solve the problem is the parathyroid injection caused in the thyroid surgery, and the solution is one use the ILNP based negative imaging, and the second is use the CSRPG targeted the positive imaging. So the result is INP 10, 10 nanometers at the 20 mg per ml works in the rats and the rabbits model with no contamination. And CASR's probers lights up PG in rats. So the conclusion is both the technologies help identifying the PG during the surgery. They are safe, effective, and ready for clinical trials. So before we end, let's highlight our research achieved. We have already published one paper is on the ILNPs, and then got the grants on the CASR's protein design. Our goal is turn to these preclinical tools into clinical solution, reducing the parathyroid injection and improving patients' quality of life. Thank you for your attention today.